Morning guys, my name is Jisoo. I'll be presenting with Nicole and Jesus. We are presenting case study number 20. Medical assessment. Our patient is a 50 years old white Caucasian male. He came to dental clinic saying that he is concerned about the stain on his front teeth and always have a dry mouth. He does have a several medical condition. He suffered a slip disc in his neck 10 years ago. Complain of shoulder pain when reclined for a long period of time. Smoke 1 pack of cigarette daily. He drinks 2 to 3 alcoholic beverages weekly. He wears contact lenses. He doesn't have any allergies. Also doesn't take any medication. Question number 1. Here. What ASA classification is this patient? Is it 1, 2, 3, or 4? Keep the answer in mind for future slide. Dental assessment. For his dental assessment, he is overdue for his dental visit. His last visit was 8 months ago for prophylaxis, and his radiographs taken was 4 years ago include full mouth x-ray with 16 periapical x-rays and 4 bite wing x-rays. We also took his intraoral image including front view, palatal view, and mandible occlusal view. He brushes and flosses regularly using fluoridated toothpaste, reports frankly having a dry mouth. For his x-rays here, we can see that the patient has generalized horizontal bone loss along with furcation involvement on posterior molars. These furcations can be classified as 1, 2, and 3 in localized areas. Oral and intraoral findings. Extraorally, he has TMJ crepitus present on the right side. Facial symmetry, ribs, skin, and larynx were all within normal limits. Intraorally, his oral tissue were all within normal limits. No abnormalities noticed on his cheeks, lips, tongues, or pharynx. Gingival tissue appeared normal. Localized inflammation found on the lingual margin of his maxillary and mandibular molars. Tobacco stain on anterior maxillary and mandible. Extraneous ink-string stain, which is restorative material amalgam, were found on his mandibular molar. His occlusal classification was oral class 1. He has crossbite on his left side between number 12 and number 20. His current restorations are: he has 1 full gold crown and 5 fillings. His active caries on number 7 distal of the tooth and number 6 and 8 mesial of the teeth. We see his missing teeth on number 2, 14, and 15. In his intraoral image, you can see his extraneous ink-string tobacco stain on his maxillary and mandibular anterior incisor areas. And also restorative amalgam stain on number 19.
The patient's overall gingiva is pink in color. His maxillary-free gingiva is scalloped, firm, glossy, and shiny. His mandibular-free gingiva is spongy with rolled borders with a shiny texture. His maxillary attached gingiva is firm with blunted papilla and is keratinized. And his mandibular attached gingiva is spongy, swollen, and shiny. Our patient did have generalized recession of 1 to 3 millimeters. He also had furcation involvement on teeth numbers 3, 18, 19, 30, and 31. He has mobility class 1 on teeth numbers 3, 19, and 27, as well as mobility class 2 on teeth numbers 18, 26, and 31. We classified our patient as having AAP stage 3 periodontitis. He has a calculus code of 6 heavy. He also has some generalized horizontal bone loss, and his bleeding index is 15% with a plaque score of 20%. Patient's periodontal chart. As you can see, he has pocket depths going up to 9 millimeters deep. He also has some missing teeth, as well as exudate on tooth number 21. He has bleeding upon probing, and he does have a stainless steel crown on tooth number 3. Question 2. How many appointments will be required? A3, B4, C6, D8. Here are the answers to our questions. Question number 1, the answer is ASA classification 2. This patient, although all his vital signs were within normal limits, he does smoke 1 pack of cigarettes per day, therefore classifying him as ASA class 2. For question number 2, our answer is 8 appointments. Our patient suffered a slip disc 10 years ago, and he experiences severe neck pain when being reclined for long periods of time. Therefore, we have to keep his appointments as short as possible and break them up as much as we can to avoid causing our patient any discomfort during treatment.
For the patient's treatment plan, on the first appointment, we would review medical history, check vitals, extraoral, intraoral examination, take updated x-rays, get a consultation with the dentist for faulty restorations and possible caries. We would refer the patient to a prosthodontist for missing teeth. On the second appointment, we would review medical history, check vitals, extraoral, intraoral examination, and complete perio charting. We would do a perio consultation and give oral hygiene instructions. We would give smoking cessation information as it's connected with the patient's xerostomia. In the following 4 appointments, we would be treating the patient with scaling and root planning. On the third appointment, we would review medical history, check vitals, intraoral extraoral examination, and present the treatment plan. We would start scaling and root planning on the lower left quadrant as this is the most severe. We would give oral hygiene instructions and post-treatment instructions. On the fourth appointment, we would review medical history, obtain informed consent, and proceed with scaling and root planning on the lower right quadrant. We would give oral hygiene instructions and post-treatment instructions. On the fifth appointment, we would review medical history, check vitals, complete extraoral intraoral examination, obtain informed consent, and start scaling and root planning of the upper right quadrant. We would give oral hygiene instructions and post-treatment instructions. The sixth appointment, we would review medical history, check vitals, intraoral extraoral examination, obtain informed consent, and start scaling and root planning of the upper left quadrant. We would take impressions for a night guard as this can help with the patient's TMJ crepitus. We would give oral hygiene instructions and post-treatment instructions. We would schedule the patient back for a 4 to 6 week eval appointment. On appointment 7, we would review medical history, check vitals, intraoral extraoral examination, and do a complete periodontal evaluation. We would complete a full mouth prophylaxis with selective polishing. We would place a topical 5% sodium fluoride varnish. We would give oral hygiene instructions and post-treatment instructions. Our 8th appointment would be in 3 months, this being a perio maintenance appointment to encourage following up with the patient's periodontal treatment. Well, that's it, you guys. Thank you guys very much for listening.